Are your eyes looking a little bit sad? Are you sick of people saying you look tired even when you're feeling energized? Perhaps it's time for you to have eyelid surgery. Let's watch as Sandra gets help restoring the beauty in her eyes today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we'll be talking about eyelid surgery. Age can cause your eyelid skin to loosen and your eyebrows to droop, and who wants that? Well, that's all I can say. This can result in a tired, sad or even angry appearance. But before we get into all the other information that you want to know about, let's talk to Dr. Thompson how this can be corrected. Hey Dr. Thompson, how are you?
Hi Troy, fine.
Okay, I call it eyelid surgery. What is the medical terminology of this procedure?
The medical terminology is called blepharoplasty. It's kind of a long word, and most people don't know it by that term anyway, just upper eyelid or lower eyelid surgery.
Okay, so it can be caused by wrinkles, age, sagging, drooping, all those above. That's correct, isn't it?
Right, it's kind of usually a combination of several factors.
Yeah, and it's an aging thing.
Right.
It does make you look a little tired. We don't have it when we're born. Is that correct?
Right, although some people are born with a heavy eyelid to start with, and they're more likely to need this type of surgery earlier on in life than someone else maybe.
This is not just about age enhancement, it's also a medical issue as well.
Right, it's a lot of times done for a cosmetic reason, and many times it's done purely for a functional reason. As you can imagine, if the eyebrow gets heavy and that eyelid skin starts to sit down on the eyelashes, it can actually obstruct your visual field, and that's something that can be evaluated, and in those cases it's usually covered by medical insurance.
I love that. Do people understand the difference between upper and lower, and is it the same procedure?
Upper eyelid surgery usually is done for the visual field or the sagging eyelids, and it does make you look tired, but the lower eyelids can also make you look very tired if you start to get hollowed out under here or puffiness and bags under there, and that's a completely different surgery, and that's never covered by insurance because it's almost always done for cosmetic purposes.
It's an aging issue,
Right.
but genetically, is it a genetic thing as well?
Yes, I mean, most people, if you look at your parents or grandparents, you'll have kind of a good idea what you're going to look like in 20 or 30 years.
Yes.
And I've told some of my patients this before. I have two daughters. One of them has a really low brow and eyelid, and she already has kind of a fullness, and probably in her 30s or 40s it'll start to maybe obstruct her vision a little bit, and the other one doesn't. So there is a big genetic component involved.
We see a lot of people who have eye surgery on TV, celebrities, you know, just crazy people out there that have had work done and they've gone too far.
Right.
Does it depend on how much you have it lifted, or can you explain that?
Yes,
can you have a little bit done? Or?
A lot of times people are really worried about, you know, what they may look like if they do a surgery like this. For example, a man, you have to be really careful about removing too much skin or lifting the eyebrow too high, because that will look very unnatural and feminize a brow if you're not careful. And so the brow and the eyelid kind of work very harmoniously, and so you have to be careful that you don't take too much skin. If you take too much skin, you can have a problem of not being able to close your eye or having a dry eye problem. Or if you lift the eyebrow up too high, then it just looks unnatural.
Well, now you're saying that, bringing up a few of the issues that could come about. What do you say to people sitting at home to put them at ease about that when they come in to see you? Is it looking at before and after shots? Is it really finding out what they need?
Part of it is looking at before and after, but part of it is really finding someone that evaluates you as an individual and, you know, has seen a lot of these before, and then they can give you a good recommendation on what to do, because it really is different for each person, and as we'll see today with our patient, her situation is completely different than the next person that might walk into my office.
What's more popular, upper or lower work?
Upper eyelids is more popular, and I think that's primarily because it a lot of times has a functional component as well.
I always had bags under my eyes, and probably about 3 years ago I started to have some filler put along the crease to fill it out a little bit. Is that something you can do prevention-wise until you're ready for surgery?
Absolutely. That's one of the greatest advances we've had in lower eyelid surgery, is that now instead of rushing in to do surgery when someone maybe doesn't need it, we can usually temporize the situation with a little bit of filler, because that'll just camouflage that bag that's starting to develop with a little bit of filler, and it really is a great technique.
I want you all at home to look at this next little bit of information that you can do regarding fillers for your eyes. In addition to eyelid surgery, injectable fillers and Botox are excellent non-surgical options to achieve total rejuvenation to the area around the eyes. Small amounts of Botox to the lateral brow area can achieve a subtle aesthetic lift and more open visible eyes. The forehead and area between the brows are two other common areas where Botox works wonders, treating furrows and a serious or angry look. Dr. Thompson, we've been going now for quite a few weeks on the show, and one of the common things that people are asking me at home, okay, so when I'm out in the street, they're saying, we love the show,
Right.
but can you ask the doctors, how do you prepare for some of these surgeries? So I want to ask you, how do you prepare for eye surgery?
As far as surgeries go on the face, eye surgery is probably one of the more simple surgeries.
Yeah.
It's performed in the office under a straight local anesthetic. You don't have to go to sleep, you don't have to go to a hospital. The recovery is relatively easy. But from a preparation standpoint, I guess the other thing to be aware of is that you will have some bruising. Everybody gets some bruising, and so you got to keep that in mind when planning the timing of something like this.
I think you've got to be fooling yourself if you don't think you're going to have any bruising at all.
Yes.
Like seriously.
Right.
It is an operation.
Yeah, it's an operation, and 90+% of people have some bruising. There are occasionally people that don't, but most people do.
Dr. Thompson, people also want to know, which I think is really important, is there scarring, and where do you put the stitches?
The incision, there is an incision in the skin, and it goes right in the upper lid crease, which is kind of a place that's normally hidden because we normally have our eyes open. And then it does extend out to the side a little bit, and it should extend out of the side, because if it doesn't, you'll miss this skin that's kind of laterally. And so this part of the incision is a little bit visible, but after about 2 to 4 weeks, it's pretty tough to see.
Okay.
For the lower eyelids, the incision is inside and you don't ever see it at all.
What do you mean inside?
It's actually inside the eyelids.
Oh, so you're actually pulling down the skin around the eye
Yes.
and doing the stitch on the inside?
Right, and they're actually, the stitches and everything is done from the inside, so you don't have a scar at all.
Can you tell everyone there must be a few risks involved?
Yes, bleeding and infection are always risks of any surgery.
Yes.
And bleeding around the eye can be devastating if it gets down into the eye itself.
When you say devastating, in what way? Just visually?
Visually, I mean, on every consent form for an upper eyelid surgery, we discuss blindness. I've never actually seen that happen, and it's extremely rare, but any time you're working around the eye, you're taking, a risk of that eye. Now, fortunately, with the upper eyelids, we're actually not down in the eye, and so it's almost zero chance of anything like that happening, but any structure you work around surgically is potentially at risk a little bit.
So just basically visually, that really is the only risk. What about drooping of the eyelid after the surgery?
Drooping of the eyelid afterward is probably a theoretical risk as well,
Okay.
but it's, again, something we just don't see.
It's
Yeah.
minor. And I like the fact that you said in all the years that you've been doing this, you've never seen someone go blind.
No, even in all my training, I've never seen it happen. I've certainly read about it in journals and things like
Yes.
that, and so I include that in my discussion with the
I think
patient.
that's really important. Coming up after the break, we'll hear from Sandy on why she wanted this procedure done. Then we're actually going into the surgery room to see how Dr. Thompson performs Sandy's eye lift. The following footage contains actual surgical procedures. It may be too graphic for some viewers.
I'm Sandy Carpenter and I'm 48. I decided to have an eye lift done because the eyelids are droopy, and so my eyes always look like I'm tired, and they've been touching my eyelashes, and so I just wanted to have brighter looking eyes. Plastic surgery does have a stigma with it that you're not going to look natural, and that's why I chose and sought out and researched Dr. Thompson, so that when I have this procedure done, that I don't look like I've had some plastic surgery done. I want to look natural.
Hi Sandy, how are you today?
Thompson, great.
Good. You ready to do this?
I am.
Good.
I'm excited.
So what I'll be doing is, turn this way just a little bit, that's good. I'll be making an incision right along the crease of your eyelid here on both sides, and it'll just be hidden right in the natural fold of your eyelid, and then it'll extend from the side here up this way just a little bit, and that'll give you a more natural contour when this is healing, okay? So we'll take enough to just kind of clean that up so you don't have that extra skin there, but it should still look really natural.
It's a good thing to have plastic surgery done. I felt really good about it and the decision that I've made with it, and I feel very confident in Dr. Thompson and doing this procedure.
I'm just going to gently pinch this skin to make sure that if we did remove that amount, it wouldn't pull her eyelid open, which is be a bad thing. We want her to still be able to close her eyes. Okay, come over to the other side now. Okay, good. Now I'm going to just take a measurement to make sure that both sides are the same. So this will make the whole area numb where we'll be working, and this will also help to minimize bleeding.
You can feel it numbing already.
Can you? This skin is really pretty thin, and most people say it really doesn't hurt very much getting this numbed up, and this is really the only pain, so it's a relatively pain-free procedure.
It really is.
Okay, this is a Betadyne's cleansing solution.
People that I talk to about it, they are curious about the procedure of what is involved in having the eye lift, and they're also curious to see what the results will be like, and so I'm excited to show them the results afterwards.
So the eyelid skin is thin, and so we have to be pretty superficial with our incisions. You know, when I'm doing a procedure under local anesthetic, I want to make sure that they're comfortable, and you know, a needle hurts if you don't have local in, and so, you know, usually they'll tell me, but sometimes they think they have to tolerate the pain, and it's really not the case. We can always add a little bit of local if we need to. Now, some people have a really thick layer of orbicularis muscle here, which is the eye opening muscle, and a lot of times that needs to be trimmed a little bit if we're taking some skin as well. She doesn't have a lot of that, and she also doesn't have a lot of fat that sometimes we'll trim, so mainly we'll just do a little bit of cauterization here to prevent bleeding and minimize bruising.
I'm expecting to look more youthful after having this procedure and to have the wide-eyed, bright-eyed, awake look instead of being so tired.
I'm placing a stitch called a vertical mattress suture, and that's a stitch that goes through the skin twice. The advantage of that is that the skin will be really bunched up here while the stitches are in, and that helps to give us a really fine line scar. The quicker we get the stitches out, the less likely they are to leave any mark in the skin. And this skin is very vascular and it heals very quickly, so the stitches really don't need to be in for very long. Have you had any pain, Sandy, at all during the procedure?
No pain at all. It's been really nice.
So we're just closing up your incision here on the left side, and then we'll move over to the right. I like doing surgeries under local because it gives me a chance to visit with the patients, and a lot of times we have all kinds of interesting discussions. And she's not sedated at all, so I'm not getting any really juicy information that I might be getting if she were.
I want you to concentrate on the eyes.
Yeah. So, Sandy, I don't think you'll get a lot of bruising. There wasn't a lot of bleeding. I did cauterize a few areas. And the eyelids are swollen right now because of the local that's in there. And They'll swell up a little bit more over the next 24 hours, and then they'll start to go down. Okay, now we'll move to the other side.
For anybody who's interested in having this procedure done, I would strongly recommend them looking on their websites for the different doctors, the plastic surgeons that do this, and meeting with them and consulting with them.
This is one of the few surgeries that cross over the cosmetic and the functional side. Sandy's eyelids are not to this point, but a lot of people that come in to see me are actually beginning to experience visual field loss because the skin gets so heavy it hangs down on the eyelashes and obstructs the vision. And it's fairly common. You know, most of us, if we live long enough, will eventually have some of that obstruction from the excess skin. So I see a wide variety of eyelid hooding, we call it, just depending on how old the patient is and kind of what their goals and objectives are.
I'm really excited about getting this procedure done. I've been looking forward to having it done for many years, and it's finally to the point where I can have it done, and I'm just really thrilled to be able to have that wide awake look, and I'm excited to have this surgery done.
Okay, now the silk. Okay, that's all there is to it. She's going to put some ointment on here and some pads. I just keep those on for the rest of the afternoon and evening.
Okay.
And then even tomorrow, I think the more you can keep the ice on your eyes, the less your swelling and bruising will be. So, what'd you think?
That was the most relaxing. It was great.
And it looks a little weird with the stitches going up to the side there, but when they come out, it'll be pretty tough to see those incisions. We'll call and check on you tomorrow and see how everything's going. And I don't think you'll need much in the way of pain medication, but you have them if you need them, so all right.
Thank you so much.
You're welcome.
Coming up after the break, I'll be bringing Sandy into the studio to talk to me and Dr. Thompson and to see her final result. Do you want all of my tips and tricks for creating the younger you? Be sure to go to theyoungeryou.tv/contest for your chance to win a signed copy of my best-selling book, Guide to the Younger You. Be sure to check out the Younger You website to watch full episodes of the show, stay up to date on the Younger You Challenge, and get useful tips and tricks to help you achieve the younger you. Welcome back. Dr. Thompson and I have been joined in the studio by Sandy. Hey, Sandy.
Hi, Troy.
How are you?
I'm great.
Before we get cracking into the conversation, let's take a quick look at your before and after shots just to refresh everyone. When you see pictures like that, Sandy, what do you think?
It just confirms what I had decided about having the surgery. My eyes are more opened, I don't look tired.
Can I just say, looking at you just head on, your eyes are so open. Why did you decide to have this type of surgery?
So that I didn't look tired all the time, and just gives me a little more confidence.
Well, when you say confidence, in what way? Because you're pretty outgoing.
Just the tired look.
Dr. Thompson, is that something you hear a lot of?
Yes, that's probably one of the most common things I hear with eyelid surgery is I look tired, or people tell me that I look tired and I'm not tired.
Did you try anything else before you saw Dr. Thompson regarding injectables, makeup, anything like that to try and stay off the surgery routine?
Yes, I have. I've tried the creams, the lifting creams, but nothing works. And so that's why I chose to see Dr. Thompson, and he's very good at it, and he has that natural look, and that's what I wanted.
Funny you say that you said you tried creams and makeup as well. Let's take a quick look at some great tips on how to wear makeup to fix those sagging eyelids. Dab a small amount of liquid concealer onto a makeup sponge and gently apply it to the entire eyelid, from the lash line to just below the brow. The concealer will allow the eye makeup to last longer. Apply pencil eyeliner to the lid only, from the outer edge to the area where the pupil is. Do not line all the way across or stop directly in the center of the lid, as this will cause the eye to appear narrow. Use an eyeshadow brush to apply the light toned eyeshadow on the upper part of the eyelid, from the innermost corner of the eye to the center of the lid. Apply the dark eyeshadow to the eyelid, starting at the lash line. Begin where the eyelid is droopiest, usually near the center, and extend outward in a wing shape. The wing shape, which should be almost at a diagonal, give the eyelids an appearance of a lift. Sweep a light line of the highlighting eyeshadow right underneath the inner edge of the brow. Light colors such as silver or white open up the eye. To open eyes more, curl lashes and finish with 2 coats of black mascara. Dr. Thompson, when you have these types of surgeries, how long does the procedure normally take?
Well, the procedure takes about an hour to do this kind of surgery. And in Sandy's case, I didn't take a large amount of skin from Sandy, but it still takes about an hour, and the recovery is pretty quick.
Cosmetic or medical for the procedure?
Right. In her case, this was purely for cosmetics.
Oh, you're so vain. You crazy woman. Downtime. Okay.
About a week.
About
is
a
what I
week.
tell people, yeah. And it's not down for a week. It just means bruising, and you should kind of take it easy for about a week.
Sandy, when you decided to go down that road of having surgery, did you have a picture of what you were thinking in your mind?
I wanted to have that look when I was younger, and my biggest fear was not having enough eyelid taken away. We had talked about that, and he reassured me that it would be the right amount.
Touch on that for me. You wanted more, or you thought he wouldn't take enough?
That was my concern, that not enough was going to be taken out.
Oh.
And that is oftentimes the case. If people are going to undergo a procedure like this, they want to make sure that they're going to get a result. It's done, and they want the result that they want. And so, and I try to caution people, you know, I'm going to take an appropriate amount, but I don't want to take so much that we create a problem for you that you didn't have before.
Well, you actually said if you're taking too much out and have too much of a dramatic change or too much lifted, it can actually cause dryness of the eye, issues about blinking.
Definitely, and it can also look unnatural, and so those are all really important things. And most people don't bring in a picture and say, I want to look like this person. They say, I want to look like me.
What do you say to someone watching you at home saying she should never have had her eyes done?
I would have to disagree. After seeing the results of the before and after pictures,
I
it looks
agree.
so natural.
Dr. Thompson, what do you see when you see these pictures?
When I look at Sandy's before pictures, I see the start of some excess skin. From the frontal view especially, you see that. She's never had that before, and so we just needed to do something fairly conservative to get her back to the point that she was at before.
And when we look at this picture, Dr. Thompson, of the after on around the eye, she looks so smooth and fresh. Her eyes look open. You just did the upper. You didn't do any resurfacing.
Just the upper eyelids. We didn't do any resurfacing, but a lot of times I will add some Botox. I might do something to resurface the eyes.
And why is that?
Because it just helps to enhance the overall result. A lot of people, when they squint, they start to develop these lines we call crow's feet.
Okay.
And they can become very deep. And a lot of times, in combination with an upper eyelid surgery, we'll do some of those procedures.
Okay. Dr. Thompson, does Sandy need to have a top-up in, say, 10 years?
Yes, definitely.
Okay.
I mean, there are going to be things that happen as she ages, and it won't be her upper eyelids.
Are you serious?
It won't be her upper eyelids. It'll be something
Okay.
else that's just kind of progressing. And so maybe we'll say, you know, your eyelids look great, but now we're starting to get some deep lines here, so maybe we'll want to do something about that.
Sandy, people are watching you at home looking at the before and after shots, but are too scared to make that call. You said to me off camera that it was all about research. Explain to me what you mean by that.
Yes, you need to research their credentials and education and their background and their history.
How did you do that?
I looked online and studied several different doctors.
Phone calls? Did you want to see their work?
Yes, phone calls, their work, their history.
How important is it to actually do that, Dr. Thompson? Because people say they do. And let's be real, not everyone does.
It's critical. It really is. I mean, if you're going to be doing something, especially on your face, the thing that people are seeing you every day, it's really important that you, first of all, know the background of the physician that you're looking at, but there are so many other things that come into play as well. Just your interaction with that person. Sometimes, you know, I might have a consult with somebody and we don't quite just hit it off. And even if I am, you know, competent and good at what I do,
Well, you are
I need
good
to
at
have,
what you do.
I need to have that connection with the patient as well. That's important.
Sandy, when you saw Dr. Thompson, what was it that made you say, yes, I want him?
It was that connection. I would have to agree. It is that connection, and you know, after studying everything and then meeting him, and we had the consultation, and it was a definite yes.
Okay, I think that's fantastic. You said you were feeling less confident when I first interviewed you. You're more confident now?
Definitely.
Really?
Yes.
I think you look stunning.
Thank
She
you.
You
does.
really
Stunning.
do. Doesn't she? Dr. Thompson, I think it sounds great when you hear comments like that.
It makes me excited, and it's what kind of makes me excited about my job is these kind of conversations.
That's what, we're just about to wrap, but I wanted to ask you a quick question about that. When you say, I'm excited about my job, you are changing someone's life. Not just visually, mentally as well.
Right, that's one of the things that is the most gratifying about my job, is the chance that I have to, you know, impact people's lives for the positive, and it is very gratifying, and it makes my job feel like it has a lot of meaning and purpose.
Good. Thank you, guys. Sandy, thank you for allowing us to watch you on your journey.
Thank
I
you, Troy.
appreciate that. Dr. Thompson, once again, it's so great to see you.
Thank you.
Thanks for coming in. Eyelid surgery can make your face appear brighter and more refreshed. The decision to have cosmetic surgery should be a personal one, and if this procedure is going to give you more confidence, then I say go for it. For more information about the show, please visit our website at theyoungeryou.tv, and I'll see you next week. Is your skin looking loose or wrinkly? Next week on The Younger You, we'll be watching as Diane, Sue and Mona all get their skin tightened, resurfaced and refreshed. The Younger You set provided by Madison McCord Interiors.